Hey, what's going on, y'all? I've been seeing a few things coming across my feed and online about this increase in RSV, Respiratory Syncytial Virus. And I just wanted to jump on here real quick to hopefully dispel some concerns, address some of the language that's being used in the media, and hopefully empower especially parents who are concerned about their little ones when it comes to this infection. The first thing I want to talk about is some of the terms you'll see utilized as the cases are being reported. You'll hear things like there's an increase, there's a surge, there's talk about how this is happening sooner than usual, right? And sometimes what this does is create this picture of like this doom and gloom, and basically it's like around every corner and stuff like that. And these words, though they may be true, and I'm not claiming that they're not true, I'm saying that these may be true, but they're relative terms. What does that mean? It means that, for example, if I had 5 cases of RSV on Monday and 15 cases on Thursday, I can tell you that there was an increase, that there was a surge, right? I can call it rapid because it was over the course of 3 days. But what's actually happening is we went from 5 cases to 15 cases. It doesn't mean it's unimportant. It doesn't mean it doesn't matter. I'm not trying to say that. I'm simply addressing the fact that these terms are relative, and they can give off this kind of sense of something being bigger or more dangerous than it may really be. With that being said, I want to be clear here. RSV is, by definition, a deadly virus. But what does it mean when we say that? Well, by definition, it's deadly because it has caused death over the years, right? In fact, the Journal of the American Medical Association reported just this year in February 2022, looked at over the course of 19 years how the frequency of death related to RSV. And what they did was they took 50.3 million death certificates, again, over 19 years. And these were deaths of all kinds, and looked at from those death certificates, how many of those deaths were caused by RSV. What they found is on average, every year, we were having around 6,500 people would die from RSV. So does that mean? That means by definition, RSV is deadly. RSV can kill you, right? But to put that in context, if we were looking at 50 million cases of 50 million deaths, 50.3 million deaths over 19 years, that would work out to about 2.6 million deaths a year. And of those 2.6 million, 0.25%, so not even 1% of those deaths are related to RSV. And then of those 6,500 plus or minus deaths that are RSV related, only on average, 96 of those were in children less than 1 year of age. Again, that still sucks, right? Those people have died, and including those little ones. But what I'm hoping to illustrate to you guys is, while yes, by definition, RSV is deadly, when our children and our friends and family get RSV, it is not necessarily a death sentence. Typically, what happens with RSV, it's a very common upper respiratory infection. We're not even sure that we catch all the RSV cases, because what usually happens is you get a runny nose, you get a cough, a low-grade fever. It's more common in children 2 to 6 months of age, but of course, children older than that get it. And our elderly population can get pretty bad for them. But the most common course of this infection is that it's a cold. It typically presents itself as a cold, not benign, right? Again, can cause death, and it has been associated. And there's suspicion that it may be even involved in childhood asthma and causing childhood asthma. I'm not saying it's benign. What I'm trying to emphasize to us is that it is common, and typically the course is not dangerous. Typically, patients will usually recover. Those who have a worse time are younger, premature babies. They have they're immunocompromised. They're on medications that decrease their immune system. They're older. They're exposed to smoke. They have other risk factors at play that make it more dangerous, right? So what we're usually seeing, a mild cold, runny nose, cough, and low-grade fever is what we usually see. What are the things that we look out for? Is we want to make sure that our kids are still feeding, right? That they're staying hydrated, that they're resting. Okay, so there's some concerning signs where we do want to seek medical evaluation, and that's when we see our children working harder to breathe. So what does that look like? In a small child and a baby, you might see them breathing more rapidly. There's actually something called comfortable tachypnea, where they are breathing fast, but they look comfortable. And sometimes parents will think that just because they don't look like they're in distress, the baby's okay, and they're just like, but that rapid breathing is abnormal. That's the body trying to compensate for a lack of air. The other thing is, of course, the nasal flaring, where they're trying to open up their nose so they can get more air. They do it involuntarily. Sometimes you'll see kids that are grunting. They're gonna as they try to put positive pressure back into their airways. And then, of course, you'll see the diaphragm sucking in underneath, or potentially retractions inside in the actual sternum here. Those are the things that we look out for. That's what you definitely want to get checked out. But typically, what do you do to manage this? It's supportive care, right? Making sure they stay hydrated, making sure they stay rested, clearing nasal secretions, right? The nose fritter is one that we use in our home. A humidifier, standard humidifier, keeping the air humid for them, and then making them comfortable. Plus or minus fever control. Usually at around 100, 103, you might want to lower that fever, especially with young children. Increased risk of febrile seizures. Doesn't increase the risk of epilepsy, by the way. But anyways, so with that, I just want to hopefully put you guys' mind at ease, give you some things to consider. Always feel free to reach out to me if you have any questions, talk to your medical provider. But yeah, I hope that sheds some light. I hope that's useful. Let me know if you like this. I could make more videos like this to address some concerns for y'all. Love you guys. Bless y'all.